A high percentage of sex trafficking victims may go to an emergency room or a doctor's office while they're being trafficked. And before, doctors didn't know what to look for. But now Dignity Health has created a training to help staff pick up on the signs and maybe save a life.
20, rate of 104.
Inside Dignity Health Methodist Hospital of Sacramento,
41-year-old male, 10 pain times 5 years. We'll see you in 5.
clinical coordinator Carlton Hall says he never thought to look for these signs, but now it's part of his normal patient assessment.
Well, we're looking for signs of abuse, signs of guarding, signs of not wanting to answer questions necessarily in front of another person. And if we see that type of behavior, it raises a flag for us.
According to a 2014 report from the Annals of Health Law, 88% of sex trafficking victims end up in ERs and clinics at some point while they're actively being trafficked. Oftentimes, they go to the doctor with their pimp or trafficker posing as a relative.
I was a victim of human trafficking when I was 13. I was kidnapped and trafficked across state borders.
Sawan Vaden of Oak Park was a runaway at the age of 13 and was soon introduced to prostitution in Sacramento. Vaden says she wishes this medical training was around when she was being abused.
There were times when I felt like I would die. There were times when I had really bad dates and came close to death, you know? And there were times when I went to the hospital and no one thought to ask me a question. Just ask me, you know, are you okay? Can I help you? Something going on? Is he chasing you? You know? I would have been great. I would have loved to have had that.
And now, because we know what to look for.
Sacramento family physician Dr. Ron Chambers says this training will help guide doctors and medical staff to ask the right questions.
There's not many people in the community that interact with a trafficking victim while they're being trafficked. We have that rare opportunity, and so we need to know what to do with it.
Dr. Chambers has been heavily involved in the research and effort to fight human trafficking, which refers to the use of force or coercion to engage victims in sex or labor services against their will. Within the past year, he and others at Dignity Health have helped develop a specialized training that's being rolled out throughout 39 hospitals, aimed at recognizing the telltale signs that he says.
We're seeing patients that we missed in the past, that I can look back in their medical records and I can see that we saw them and we missed it. Or we didn't know the appropriate questions to ask. We didn't know the tattoos to look for.
Tattoos are a warning sign, like a crown over a guy's name in the shoulder and neck region.
Another real common one is something that says daddy's little girl or daddy's princess.
Dr. Chambers says texting at inappropriate times is also very telling.
You know, if you're doing a pelvic exam on a patient and they're texting, in the past I might have thought, that's just odd, you know, new generation text all the time, and their pimp may be out in the parking lot and might be telling them, you need to text me every 2 minutes because I need to know what's going on, as a control mechanism.
Sex trafficking has become a huge problem in our communities. Much of the trafficking happens on illicit websites and in hotel rooms, and often involves transporting victims across state or international borders. Now, the average age of U.S. children being forced into sex trafficking is 13. But Dr. Chambers says here in our communities, he's seeing it as early as 5 years old.
And I think the real key with
Dr. Chambers is pushing this training in Dignity Health's residency program, where doctors are just starting their careers.
So this training has actually been really crucial in allowing me to take a step back and really assessing the situation, saying what's going on.
The goal is to train medical staff to approach victims they spot in a way that's safe for the patient and the staff member.
What we want to do is make them aware that they're in control of when and how we intervene. Mm-hmm. And this is a safe place. Right. They can come back, we can help them today, they can come back tomorrow, they can come back next week, next month, next year. As long as they know that this is a safe place and that we're going to help them when they're ready.
So we asked, is there a sign that the average person outside a medical office can look for to spot a sex trafficking victim?
If you ever see a young girl with an older gentleman and she's very reserved, you know, she's always just looking straight or looking down. She's not looking around like a normal person would look, you know what I mean? And observing her scenery, she's just straight or down. That's definitely something going on with that.
She says if you see something, say something to authorities.
There are so many women and young girls that get overlooked and go right back into the hands of danger, and to know that that may be prevented, it's awesome.
Now, Dr. Chambers has been speaking at a number of national conventions, pushing to make this a required training at hospitals around the country. He says the real game changer would be to get this training into residency programs where doctors are educated early on.